everyone, welcome back to my channel. In today's video, we'll explore the differences between stress, anxiety, and worry, and how they impact our nervous system, including the vagus nerve. Plus, I'll introduce you to a powerful tool, diaphragmatic breathwork, to help calm your nervous system and reduce stress and anxiety. Let's get started. So let's begin by distinguishing stress, anxiety, and worry. We often use these words loosely, but is there a difference? So stress is a natural response to an external trigger, such as a deadline or a personal challenge. It activates our sympathetic nervous system, preparing our body for action and for fight or flight response. This response can be beneficial in short bursts, for example, and can help you prepare for a job interview, also to motivate you to get up in the morning and move through your day. Stress or the stress response should be like a wave. It starts, it peaks, and then it subsides, bringing our bodies back to balance. Sometimes, however, this is not the case, and stress can linger, become chronic, and leading to health issues. Next, we have anxiety. Unlike stress, anxiety is often more generalized, feeling of unease or fear, even without a specific trigger. It can lead to persistent worry and may cause our body to be in a heightened state of alertness. Often there are specific triggers that anxiety attaches to over time, for example, social anxiety. Now, worry is often about specific concerns or fears, such as financial issues or personal relationships. It can contribute to both stress and anxiety, creating a cycle that can be hard to break. Worry also manifests in the mind by way of thoughts, worry thoughts, what ifing, shoulds, often what we would call thinking traps. So for example, for many of us, it's catastrophizing or engaging in black and white thinking. Now, here's a simple but effective tool to tackle worry thoughts, and it's called the 3 C's of anxious thinking, part of cognitive behavioral therapy. It's called Catch It, Check It, and Change It. You can find this practical tool on my website, and I welcome you to check it out and leave a comment below indicating how this tool was like for you. So all of these experiences affect our nervous system, particularly the vagus nerve, which plays a key role in regulating our body's response to stress. This nerve connects the brain and the various organs and helps manage our heart rate, breathing, and digestion. When we're stressed or anxious, the vagus nerve can become less effective, leading to further anxiety. Our breath also becomes compromised, and this is where we'll turn next. Let's dive deeper to understand how stress, anxiety, and worry affect our nervous system, and then discuss breathwork, a simple yet powerful tool to calm the vagus nerve and reduce anxiety. So when we're stressed, agitated, or generally busy and distracted, our breathing is fast and shallow. Rapid, shallow breathing activates adrenaline and cortisol, the stress hormones responsible for fight-flight response. In contrast, deep, slow exhalations activates the parasympathetic nervous system responsible for relaxation. Mindful, conscious breathing is one of the fastest and most effective ways we have to self-regulate and change our brain chemistry, including other health benefits. Deep breathing, belly breathing, or more specifically, breathing with your diaphragm can help you relax and manage stress in addition to many other health benefits. Yogis have for thousands of years mastered this tool, and various kinds of breath work exist for different issues or goals, including our own starting point. Everyone can breathe, and the more we practice, the more we can work with our nervous system. So why does breath work work? Our breathing is fascinating because while it is controlled by the autonomic nervous system, in charge of bodily processes that you don't need to put any thought into, such as digesting food, regulating body temperature, and blood pressure, breathing is the only activity that it is both involuntary and that we can also control and manipulate. Meaning, by learning and practicing different kinds of breath work, such as deep breathing, we can help regulate the autonomic nervous system, leading to various benefits. And these include lowering your heart rate, regulating blood pressure, helping you relax, lowering the release of the stress hormone cortisol, and many, many other functions. So today I'll share with you diaphragmatic breathing, sometimes called belly breathing. So what is the diaphragm? Your diaphragm is a dome-shaped muscle located across the bottom of your lungs and the rib cage and above your stomach. This muscle flattens as you inhale and relaxes when you exhale to pull the air out of your lungs. If you're unsure where it is located, place 3 fingers right above your belly button and sniff. You should feel your diaphragm move when you sniff. So we're all born using our diaphragm to take deep breaths, but as we age, we often get into the habit of using our chest for breathing and shift to shallower breaths. So why is the diaphragm important? Diaphragmatic breathing, or deep breathing, allows the body to trade more incoming oxygen for outgoing carbon dioxide. This causes the heart rate to slow down and can lower or stabilize blood pressure. Using your diaphragm also activates the vagus nerve, which is the nerve in your body that triggers your body's relaxation response, or the parasympathetic nervous system, and lowers the body's stress response, or the sympathetic nervous system. Diaphragmatic breathing can help manage symptoms of chronic pain, irritable bowel syndrome, depression, anxiety, and also sleep disorders. In the yoga tradition, diaphragmatic breathing is thought to also create more space in the rib cage. Imagine as you inhale and expand the sides of your ribs and belly, much like filling up a balloon, we create more space in the thoracic region, including lengthening our spine. As we exhale and contract the belly inwards and upwards, like deflating a balloon completely, we help the lungs empty all the air out, and the gentle contraction of the belly is like an internal massage for all our organs. So, how to learn diaphragmatic breathing? Find a comfortable place, either sitting down on a chair or laying down on your back. For demonstration, I'll do this both sitting and laying down. So start by placing your hands on your stomach, above your belly button, and another hand you can place on your chest. You can also try placing your hands on the sides of the ribs. This way you can feel the ribs and belly expand on an inhale and contract on the exhale. Breathe in slowly through the nose. Imagine filling up a balloon with your stomach. Feel your hand moving as your stomach gets bigger and pushes out. Pause at the top and breathe out. Slowly through the nose as you contract the belly inwards and upwards, imagining the balloon shrinking as your belly flattens. Let's do this again. So breathe in slowly through the nose. Imagine filling up a balloon with your stomach. You will feel your hand moving as your stomach gets bigger and pushes out. Pause at the top and breathe out slowly through the nose as you contract the belly inwards and upwards. Imagine a balloon shrinking as your belly flattens. Pause here, release the belly. Inhale again, breathing in smoothly and gently for a count of 4. 1, 2, 3, 4. Pause at the top. Exhale, gently contracting the belly inwards and upwards towards the spine for a count of 6, 5, 4, 3, 2, 1. Release the belly, breathing in for 1, 2, 3, 4. Pause. Exhale for 6, 5, 4, 3, 2, 1. Inhale again for 1, 2, 3, 4. Pause. Exhale, contracting the belly for 6, 5, 4, 3, 2, 1. Breathing for 1, 2, 3, 4. Pause. Exhale for 6, 5, 4, 3, 2, 1. Pause. Inhale for 1, 2, 3, 4. Pause. Exhale 6, 5, 4, 3, 2, 1. Inhale for 1, 2, 3, 4. Pause. Contract for 6, 5, 4, 3, 2, 1. Continue breathing. Exhaling. Breathing in. Expand the belly. Exhale. Contract the belly. But continue at your own pace, slowing down the breath, making sure your exhales are longer than your inhales. After a few breaths, go back to your natural breath and observe how your mind and body feels. So I hope you enjoyed that practice. Some people will have difficulty with deep breathing because we are often used to breathing with our chests or breathing into our chest. Also, for so many of us, getting in touch with our bodies, feeling our bodies, feels strange. In fact, we often will do anything to not feel. We distract, we medicate, we numb. So trust the process that by focusing on the breath, while uncomfortable at first, you're allowing the natural capacity of the body and the mind to relax and return to balance. So be gentle with yourself, listen to your body, and work with your body's starting capacity in a compassionate and mindful way. Often finding a guided breath practice you can listen to is a good place to start. Then start with what you can do. Extending the exhales is the most important thing. Here's another simple practice that you can do anywhere. Breathing in deeply and breathing out with a big sigh. This creates an immediate release. As you exhale, you release tension in your face, your neck, your abdomen, and you can repeat this 3 or 5 times. Just immediately feel a release in the muscles, in the face, and just a sense of well-being. And if you bring a smile, well, it's hard to be miserable when you're smiling. So remember that relaxation strategies are like any other skill you learn, like riding a bike or playing an instrument, learning a new game. You get better and better with regular practice. Well, thank you so much for joining me today. Understanding the differences between stress, anxiety, worry is crucial for managing our mental health. Remember, diaphragmatic breathing or belly breathing is a powerful tool to help calm our nervous system and reduce anxiety. If you found this video helpful, please like, subscribe, and share it with anyone who might benefit. Until the next time, take good care.